In the present study, we attempted to examine whether renal transplant recipients' response status to vaccination with dosinameron is related to their baseline immune cell profile, as well as to alterations in their immune cell populations. Several authors have already proposed that immune status profile can perhaps predict response to vaccination, while vaccination effectiveness is to some degree reflected on alterations in the concentration and proportions of immune cells. We evaluated the above parameters in renal transplant recipients with regards to dosinameron vaccination. Our patients were all adults who had received a kidney graft at least 3 months prior to their recruitment. They were stable dosages of immunosuppressants for the whole study period, and they had a negative history of previous SARS-CoV-2 infection. Patients with comorbidities, recent chemotherapeutic drug or rituximab infusion, recent rejection events, viral microbial infections were excluded. Our sample consisted of 39 patients who had not achieved to develop protective humoral immunity, which means that they had negative neutralizing antibody titers 3 weeks after the second vaccination. We reassessed those patients' immunity profile 3 weeks after the third vaccination, and more specifically, we assessed their protective humoral immunity status by measuring neutralizing antibody titers with the use of chemiluminescence immunoassay, and we also assessed their specific T-cell immunity with the use of ELISpot. Patients who had either positive ELISpot test or protective neutralizing antibody titers or both were regarded as responders, while the rest of the patients were considered non-responders. We also assessed their cellular population composition at 3 time points, T0, which was exactly before the first vaccination dose, T1, which was exactly before the third vaccination dose, and T2, that was 3 weeks after the third vaccination dose. And we compared the results between responders and non-responders. So patients who were regarded as responders at T2 had the following characteristics. At baseline, they had higher concentrations of total and transitional beta lymphocytes. In the time interval from T0 to T1, they had an increased They presented an ascent in the numbers of activated CD4, activated CD8 T cells, and a drop in that of CD3PD1 T cells. While regarding fluctuations in the proportions of cellular subpopulations, they had an increase in the percentages of memory and marginalized beta lymphocytes, activated CD4, activated CD8 natural killer T cells, and a drop in the proportions of naive beta lymphocytes and CD3PD1 T cells. In the time interval from T1 to T2, they had an increase in the numbers of naive and transitional beta cells. We conclude that baseline immune cell profile, and according to our findings, mostly with regards to the beta lymphocyte compartment, can indeed determine response to vaccination with dosinameron in renal transplant recipients. And the response to vaccination is correlated to several alterations in cellular subpopulations, and more specifically to an increase of activated forms and to a drop of naive and exhausted forms. Thank you.